Hi, everybody. Happy Thanksgiving. I know you're off and you have time with your family, and I hope you had a great Thanksgiving. However, we do have content that we need to cover so that we can keep on time and get everything that we need for you to become good nurses. Now, for the most of our semester, we have talked about going through the respiratory system, the cardiac, the skin, the integumentary, the food and electrolyte imbalance. But now we also want to talk about complementary therapies. So, complementary therapies are alternative medicine aside from the medical field. It integrates the mind, the body, and the spirit. So they're saying complementary alternative medicine is saying that the mind, the body, and the spirit is all used together to incorporate health. Health is a state that is characterized by a dynamic balance of mind, the body, and the spirit. So that means the mind, the body, and the spirit all need to be in balance for someone to feel that they are healthy. Now, health is also an individual outlook. So your idea of someone being healthy and my idea of somebody being healthy is going to be two totally different things. Someone can have a disease process and consider themselves as healthy as long as they are okay in their mind, their body, and their spirit together. Now, illness is a manifestation or imbalance of the disharmony. So that means the illness is upsetting the state of health. So I'm going to give you an example. Someone can have hypertension. Now, if a person is able to control their hypertension, they're controlling their diet, they're taking their medications, they're exercising, they may have a very good balance of their mind in their head of how they're controlling hypertension, their body, which is reflective of their vital signs, and their spirit. So just because you have an illness doesn't mean that you're not healthy. So, but you can have another person who has hypertension that is not managing it well, that does not have a good attitude towards it, and are not doing the things that they need to, or not in the right state of mind to overcome the elevated blood pressures. Illness is a manifestation or imbalance of this disharmony. Is a manifestation of imbalance or disharmony. That being said, if we are saying that illness is something that takes the health balance out of it. Healing is done by the patient. Healing is a natural, slow process involving the mind, the body, and the spirit. All right, so right now we're going to talk about allopathic medicine. Allopathic medicine is when illness occurs in either the mind or body, which are separate entities, which we talked about earlier. Health is the absence of disease. Illness is an event caused by an external agent. Curing is accomplished by external agents as well, such as the medical field or alternative therapies. Curing occurs much more quickly if we destroy the invading organism or repair the affected part. Now, allopathic medicine is really not totally effective in treating chronic illnesses. Allopathic medicine sometimes fails when allopathic fails to meet needs, patients turn to alternatives. Complementary alternative therapy is based on holism concepts. So what is holism? Holism is a theory and philosophy that focuses on connections and interactions between parts of the whole. That being said, it means all living organisms, including humans, are continuously connecting and interacting with our environment. The body is not a sum of its parts, but it's a dynamic whole. So an example of this is when we treat a person, we are treating the person as a whole, not just who they are. So I will go back to the idea of the hypertension. So if someone has a diagnosis of hypertension, they are not just a person with hypertension. They're a person who has thoughts and feelings and a life and support systems or not support systems and how they handle things. So integrative care means that we use both allopathic and complementary alternative therapy. So it is sensitive and knowledgeable healthcare providers who work with patients to design a plan of care that avoid harmful interactions to which the patient's response which is responsive to the patient's preference. So that being said, what we want to do is we want to integrate allopathic and complementary alternative therapies to have the patient's best outcome. An idea of this would be medical treatment of pneumonia is antibiotics to kill bacteria. Holistic treat of that would be rest and fluids. Integrating it would be both, using antibiotics to kill the bacteria and rest and fluids. All right? Now, how often do we use complementary alternative therapy in the United States? Actually, we use in about 38% of adults and 12% of children. People use complementary alternative therapy in many different conditions. They use it to improve their health and well-being. They also use it to relieve symptoms for chronic and terminal illness and for side effects of conventional treatments, such as cancer. Insurers nowadays are increasingly paying for selective alternative complementary therapy for particular conditions. Now I want you to look down here. Under the 10 most common complementary alternative therapies, we have natural products at 17.7, deep breathing, which is what we teach our patients anyways, meditation, chiropractic and osteopathic, and it goes all the way down to homeopathic treatment. So guided imagery is also something that you use. Look at these. These are some things that we as nurses do, but you don't realize it. You use guided imagery to help relax people, massage. You offer yoga, diet-based therapies. Now we're going to go to the next slide and we're going to do a question. So which of the following nursing action is an example of integrative care? Now, I want you to think about it for a minute. Read each one aloud. The answer is A. A nurse instructs a laboring woman to use breathing exercises and assists with the administration of epidural for pain. No, it's not. It's B. A nurse providing music therapy along with the relaxation techniques for residents of a long-term facility. C would be a nurse performing a home assessment of an elderly patient and recommends referral to social services. That's not complementary alternative care. And a nurse to monitor the fetal heartbeat is not complementary alternative care either, because that's something that we is allopathic. C is allopathic, and A is allopathic. So B is the only one for complementary alternative therapy integrating into our allopathic. Okay, next question. A 35-year-old woman diagnosed with diabetes tells her nurse that she would be interested in finding out complementary therapies that are available. What would the nurse best respond? What would be the nurse's best response to this patient? Let's go through them. A. It's best to stick to allopathic medicine when dealing with diabetes. B. Complementary therapies are not covered by your insurance plan. C. Complementary therapies are being used as an answer to the problem of chronic illness. Or D. Complementary therapies are not available for this disease state. The best answer is A. So with diabetes, a lot of complementary alternative therapies are not going to manage it. So that would be the best answer. B, complementary therapies are not covered by your insurance plan. That's not true. They are more and more covering them. C, complementary therapies are being used as an answer to the problem of chronic illness. No, they are being used to manage chronic illness. And D, complementary therapies are not available for this disease state is not true. There are complementary therapies that can help with the disease state, but the allopathic medicine is best at this point. All right, so what I'm going to do is I'm going to let you rest, and then I will put up section B for different complementary alternative therapies. And we will do two questions at the end, and then once we have our second PowerPoint put up, I'm going to post a 20-question quiz that I'd like you to do. We're not going to be graded on it, but it's your content evaluation so that you can help become ready for Monday. All right. Thank you very much. I appreciate it.